What's great about Nashville? I'm actually going to talk what's great about Middle Tennessee, and I'm going to use the middle as the acronym for the different words. Did anybody do that last night? I didn't want to repeat. I would change gears really quickly. Okay, so Middle Tennessee, as opposed to just Nashville, to me, the M could certainly mean music, but I feel like we've probably talked about that. So I want to say military. I grew up in Clarksville, went to public school, my whole experience in Clarksville. My parents were part of the Department of Defense schools, and we lived in the Middle East for a while and then moved back to the area. And I will tell you that the military is a strength. And having the military right here in Middle Tennessee is incredible. It was a strength for diversity. It was a strength for the community, the kinds of people that were there, and the leadership that I think that brought to the Clarksville area was significant. The I stands for intellect. We are in this area that's called the Athens of the South, and certainly I'm in a higher ed institution, and I think the intellect that is here in Middle Tennessee, and I could speak to growing up in Clarksville, Austin Peay was sort of that home place that I learned so much about faculty and professors and the energy that comes around a higher ed institution, and that is certainly true in Nashville with about, 40 institutions I feel like you can interact with on a daily basis. The first D stands for diversity, and we're right here in a place that I can't say enough about what Renata has done in Connexion to really bring diversity together to talk about important issues. We've partnered a lot on trying to work with this particular population to make sure they have college access. And so the diversity in Nashville is a strength. The second D for middle is the deep faith. I think that the faith community in Nashville is sometimes, we take it for granted. Until you go a lot of other places and you realize that faith community may not be as strong. And we're a faith community that really does have the T, the tolerance, and there's lots of working together and working across faiths for lots of different opportunities. I think of the many philanthropic opportunities that bring the faith community in and working with people who are underprivileged. The L could mean all kinds of things, but I thought this morning, after listening to Mayor Dean and Steve Turner, the L in Middle Tennessee really does stand for leadership. We've been blessed with incredible leadership, not only in Nashville, but in other areas around this state. But Nashville has been really blessed. We've had great leadership in our mayors. I can think of 3 that I'm very familiar with, wonderful leadership, and we have great leadership in our higher education communities. We have some great leadership in Middle Tennessee in other kinds of nonprofits. I look at some nonprofits that we work with, and I just can't believe that those people are working so diligently in the nonprofit community and being so successful, and that is their love. They can make millions of dollars doing other things, but they have chosen, because of their passion, to do that in that leadership role. And so I'm excited to say we have that group of people. And the E, finally, stands for energy. The energy in this area is infectious, and it comes from the people. We have people that really do, they really love the city. They really love this area, and they are entrepreneurial, and I think that absolutely, you saw that today, and the energy around that is something that is second to none. So that's my acronym. Thanks.
I'm the one who always has to worry about time. I thought you were going to head into Tennessee.
No.
And so no, that's all right. Stacy?
So I wrote 5 pages about why I love Nashville and Middle Tennessee, but in the interest of time, I was born in Nashville, raised here, left briefly only for college and law school and for 2 years in Memphis. And I love most, there's so many things I love about Nashville, but mainly I think Nashville is a place of first, a place where there's very, the city is very forward thinking. And again, I'd go back into kind of the intellectual richness of the city. But when I think of first, I love the fact that Nashville was the first metropolitan government to consolidate totally. And because of that, we were also one of the first places to have, we were the first city to have a mayor come out and publicly say that segregation was wrong in the South, and because of that, we were the first city to actually partially desegregate our public facilities in the South. And I think that's pretty neat, and I think the most important thing, as I skip through things, is I think last night we heard someone talk about Nashville being a place of inspiration. I really think that's true, having grown up here. I think we have such rich institutions of higher education, and I think I grew up in the footsteps of a phenomenal place like Fisk. And I have to say, being a young African-American girl or black, to have and know stories firsthand of Diane Nash. I mean, I think these are people who've become popular later, but long ago, before people began to talk about them, to know of Arna Bontemps, to know all of the stories and of John Lewis, of W.B. Du Bois, Booker T. Washington. What better place could you be in than to be in their footprints here in Nashville? And so I do think it would be almost impossible to be in the city and not have sources of inspiration, and I love that most about Nashville.
Well, it's not quite time to start the forum. Do I see Michael? Or has Michael stepped out? I had heard there were a couple of questions about about our venue last time that Linda had gotten. Is there a question about about his facility, or we'll when he comes back in, we can ask him. Meanwhile, let's wait about 5 or 10 minutes. We've got a little bit of flexibility for Mary to get here, and if not, Melinda, we may start with you and start the program. So relax. We've been asked to network. Feel comfortable networking. Renata?
Logistical point. There's coffee here, strong coffee, not like the Music City Center coffee. I'm sorry. And then a couple of you asked, so please know that the coffee in front of you is a gift from the
We discovered that the Chattanooga folks have a problem with the March dates, with the January dates that we were looking at going to Chattanooga. And pardon? Yeah, that's a problem. And I think the Volkswagen folks are not available and some other things. So we've asked the Knoxville team to see if they would switch from May to January, which is no small ask, by the way. So they're checking on that. Mason's in. Okay.
He's fine.
All right. So as we speak, it's being created. And what we're looking at doing is, and that's our next session, is January 12, 13, Sunday, Monday. We're looking at starting in Knoxville and going up to the top of Neyland Stadium, we hope, for supper, and then down to the Old Town, I think, and then going to Oak Ridge for the Monday. So the Monday sessions would be Oak Ridge, which is why Tom Mason was essential. So this may work, may not. We'll be in touch with everybody to let you know. But I really appreciate the Knoxville folks for, within a period of about, 3 minutes, jumping into this and agreeing to take a look at it.
That's what folks from Knoxville do, boy. We are volunteers.
We need to hook you up, Mayor. So this session, as we have done and will continue to do through the year, we're doing sessions on government efficiency and effectiveness, on education, and on health and on healthcare. And so this one is going to be on healthcare. And I think what we decided today is to look at two parts of healthcare that are not simply in the go see your doctor and or go to a hospital. And so we'll be looking at two different kinds of models. The first one is the Healthways model, and Melinda, you can talk a little bit more about how that got started in your part of it. But Melinda Raymond is with Healthways. They are, for those of you who know Tom Cigaran, who was the founder, it's an innovative, fast-moving company, and they look at solving the problems of healthcare in a very different way from the way we used to. And then Mary Buffwack, who runs United Neighborhood Health Services, which is a little comparable to the organization that we learned about in Memphis last time we were down there. And so I'll let them talk about what they're doing. Melinda, we'll start with you and let Mary catch her breath.
Great.
I told them what you were up to, so. Okay.
Great, I think I'm good.
You're good?
I'm mic'd up. Well, great. Well, thanks so much for allowing us to come and share with you a little bit today. I'm Melinda Raymond. I've been at Healthways about 3.5 years, and I work on the product development side. So I go to work every day thinking about how to solve the complex challenges of healthcare. And just want to share a little bit about Healthways, but more importantly about kind of well-being and how we're thinking about healthcare differently and how we think you all can join with us in thinking about that in ways that you're probably already doing so. Before I get started, I want to, hold on, sorry. We don't have a clicker, so be patient with me. I want to take a step back and challenge you to think about how many decisions you make each and every day. How many of these decisions center around your health care and ultimately affect how you feel every day? Daniel Kahneman of Princeton University suggests that we make between 10 and 20,000 decisions every day. This results in roughly 6.4 trillion decisions made by Americans on a daily basis. And at Healthways, we seek to change the path of those decisions, knowing that those decisions often result in either positive or negative health outcomes. In fact, the CDC tells us that 60 to 70% of healthcare cost is due to decisions and behaviors that individuals make. The science tells us that there's really two different processes for how we make these decisions. You may be familiar with this, but we call this System 1 and System 2 thinking. System 2 thinking is conscious, it's slow, it's deliberate, it requires effort, and it's often rational. If you were gonna put a multiplication problem in front of you, you would use your System 2 thinking to do that. Your System 1 thinking, on the other hand, is unconscious. It's fast, it's automatic, it's really effortless, and often irrational. And we know that these System 1 decisions make up the vast majority of those 10 to 20,000 decisions that we make each and every day. We know that these decisions have an impact not only on our health, but really on what we call well-being. Healthways has embraced the World Health Organization definition that health is a state of complete physical, mental, and social well-being, not merely the absence of disease. While we can all agree that healthier people cost less and perform better, we as an industry have tended to neglect the underlying causes of poor physical health. Looking at your financial stress. Do you have enough money to buy the medicines you need? How much is that financial stress affecting the way that you show up in your job every day? Do you feel connected to your community? Is your community providing the resources you need for healthcare, for a safe place to exercise? Do you feel purpose in that community? Do you have a career that is motivating to wake up every day to? Do you have a purpose that extends beyond yourself? And lastly, do you have a community of people around you, social support to help you when times are bad and to celebrate the times that are good? As we've understood that this whole picture of a person really does affect their healthcare costs and ultimately their productivity, we've been steered more and more in this direction of well-being. We started this journey about 5 or 6 years ago. And when we started it, we really set out saying, surely there's a measure out there that we can look at for well-being. Surely in all the work that's going on, there's a way that we can see change and we can track progress. And we really found that there wasn't. There wasn't something that was comprehensively looking across those 5 elements and helping track and really get the pulse of how their well-being is every day. And so we set out on a partnership with Gallup. Healthways initially said, let's do this for 5 years. And Gallup came back and said, we don't do anything for 5 years. We'll start with 25 years. So we set on a journey in January of 2008 where Gallup calls about 20,000 people every day in order to get between 500 and 1,000 completed surveys. We have over 2 million surveys in our database at this point. And again, that's giving us access to individuals across a wide array of demographics across those 5 elements. And really from this data, from the Gallup Healthways Wellbeing Index, we've really been able to draw out 2 things. One is, One is understanding the causes. So from the data, from understanding and tracking against healthcare costs, tracking against performance in companies, what are the causes for high and low well-being? We have an industry of often focused on the effects, utilization, disease burden, chronic conditions, high healthcare costs, and really tended to ignore a lot of those underlying causes you see here. Several that I've mentioned before: your job, how much sleep you get at night, your hope, your position in your community, your activities, your relationships, and your experiences. In addition to understanding the causes, we've also been able to really quantify the effect. And so as Healthways, as a public company, as we look to sell products to aggregators of lives, knowing how we were going to measure that was critically important. And what we found is, as we think about well-being, as we think about that Gallup Healthways Wellbeing Index, it's more than just a good idea or a feel-good story. It really results in quantitative value. We know that a 1-point increase in population well-being shows a decrease in the likelihood of hospital admissions, a decrease in the likelihood of ER visits, and a decrease in the likelihood of healthcare costs. And these numbers may seem small, a 1% decrease in the likelihood of healthcare costs, but when you're working with millions of individuals, 1% is substantial, and 1% results in real healthcare spend. We also know that it affects not just cost, but again, productivity. We know that if you can increase the population well-being, and if that's a community, if that's a city, if that's an employer, if you can increase that by 10%, it's going to result in fewer unscheduled absences, higher reported job performance, fewer missed days at work. And all this data has been matched up against companies' real healthcare data, their real HR data, looking at those comparisons, looking at the impact of this well-being. So how do our communities compare? I know that you are from all across Tennessee, and so I wanted to in some way make this relevant to you. So I'll kind of give you a second just to look here. We've kind of brought in 6 of the primary metropolitan areas in Tennessee. And we've taken the 6 domains of well-being on the left-hand side and really given you a score, kind of red to green. It's just based upon all of the metropolitan areas in the United States. So it's really a 1 to 186 scale. You can see as a whole we're not doing too great. I think Tennessee is 47th out of 50 in terms of where we stand nationally. But there's some interesting trends in here. There's some interesting trends that you can think about as you lead in whatever sector you're in terms of how you're leading in your community. One of the things that I thought was most interesting, I'm not sure if any of you are from the Kingsport or Bristol area, but something happened in 2012. The Kingsport-Bristol area went from 118th in healthy behaviors to 24th. They also went from 77th in terms of their work environment to 16th. And it's hard to think that there's not a correlation between those two. If you think about if you have a strong work environment, if you're excited to be there, knowing that's where Americans spend 40, 50, 60 hours of their week every week, having people that encourage you in that and having a positive place there probably changes the rest of your life and probably changes the healthy behaviors there. You'll also see as a whole, though, somehow Nashville decreased in Tennessee decreased in 2012 from 16th in 2011 in work environment to 41st. What's happening in Tennessee? How is Bristol improving so much, but Tennessee as a whole is not matching that? Interesting data to really dig into. You can get all this data at the Gallup Healthways Wellbeing Index site as well. There's a state report for Tennessee that allow you to really kind of dig into that and understand how do we think beyond kind of the traditional health behaviors and really look at those other areas of well-being. I wanted to dig in one step further. I work in technology for a healthcare company. So as we think about growth and we think about where we're located, one of the things that's important to us is the digital health investment. Who's coming to Tennessee? Who's investing in startups here? Who's thinking about healthcare in innovative ways? And I pulled the data from kind of really 7 other competing cities and said, if I were a healthcare startup, where would I bring my startup? If I were going to start on this journey and I wanted to be successful and I wanted to have people that were engaged, employees loved doing what they're doing, community people that were excited about their community, which of these cities would I choose? It really just serves as a challenge for us to say, let's begin thinking kind of beyond the traditional ways that we've thought of how to attract business. Let's look at some of the deeper drivers there and say, how do we compete with the Austins of the world? How do we begin to compete with the San Franciscos of the world as we think across these domains of well-being, knowing that they have a real impact on cost and productivity? And as we think about kind of how do we improve the well-being of Tennesseans, I want to take you back to really that System 1, System 2 thinking. As a designer, this has been a powerful shift in the way that we think about our products at Healthways. For a long time, the healthcare industry has stayed in that System 2. If I can provide you enough information, I can ultimately change your mind and then ultimately change your behavior. Well, we all know this hasn't worked well. Smoking rates are on the rise, obesity is on the rise, and it's not due to a lack of information about the harmful effects of these behaviors. Instead, we have to shift our mind to thinking about those System 1 decisions, the vast majority of the 10 to 20,000 decisions people are making every day, and begin to think about changing the context around people to ultimately change their behavior and change their minds. The easiest example I have of this is seatbelt use. So for a long time, we tried to convince people that wearing your seatbelt is very advantageous. It's going to save your life. It's going to provide a lot of value. But for most of you, it probably wasn't until the manufacturer put that little dinging noise in your car that you started wearing your seatbelt consistently. We didn't provide more information. We didn't convince you in a different way that it was going to save your life. We simply changed the context around you. So when you get in your car, you hear that ding, you put your seatbelt on, and you never think about it. It's now a System 1 behavior where most people would now say they wear their seatbelt probably 99% of the time. We have to begin to think about how to change the context in order to change behavior. And as we do so, we've really come up with 5 levers that we can pull in order to do so. So thinking about changing context, we can change it for the individual. The car is a perfect example. We can change something that is pertinent to them, something that motivates them, something that incentivizes them. We can also change their access to experts. So how are we connecting with people? Who is sending them the message about why they should change? Who is motivating them? Is it coming from their HR director? Is it coming from their boss? Is it coming from their grandchild? How are we thinking about those changes? Social connections. We know that in this changing world, that your social community, and not just your Facebook social network, but the people you interact with, have a dramatic effect on your health. You are more likely to become obese if your friends' friends are obese. People you may never even know, but are going to impact your healthy behaviors and your well-being. The last 2, the surroundings, environment and policy. I'm thinking about how do we work within the environment, how do we work within choice architecture to make the healthy choice the easy choice. Healthways is working with entire communities with our Blue Zones project to think about how do we have states set up completely differently. We're right now working with the state of Iowa, who, according to the Wellbeing Index, is on a journey to become #1. So we've been working with their governor, with their local leadership to say they want to oust Hawaii as the state with the highest well-being. If you've been to Iowa, you know they have a ways to go. And so we've got our work cut out ahead of ourselves. But they've moved the needle. I think they've gone up 6 or 7 spots already from where they were 2 years ago. And it's due to things like putting in sidewalks, changing the local restaurants, serving food on 6-inch plates instead of 9-inch plates. Little things that you're doing in the environment to change the way people think. And policy. You all know this more than I do, so I won't pretend to think about it. But what are the policies, and how are the policies aligned to think about well-being? Not just thinking about healthcare cost once it happens, but to think about promoting well-being, to promoting healthy living before we even get to the point of cost. The last slide I wanted to share with you was really just a look at kind of how Healthways is doing this. So we've essentially needed to scale these 5 levers to millions of individuals. And we've done so through creating web and mobile products that allow us to do so. You'll see in the right-hand side there, the Blue Zones project. That's the program I was referring to in your community, in terms of going into communities, working with local officials, working with state officials to, again, change the architecture, change the environment people are living, working, and playing in. You'll see in the bottom right, Healthways is on a new relationship with Dave Ramsey, a local Tennessee company that many of you are aware of. Because while traditionally disease management and the world that Healthways lived in didn't require us to think about financial well-being, we now live in the world that one of the biggest barriers to people's physical health is their financial health. And time again, we encounter people that say, I understand I need to take this medicine, but I can't put food on the table. How am I going to pay for this drug? Or I'm not going to go to the doctor because I can't pay my bills. Or I'm not engaged at work because I'm spending 20% of my day just worrying about next month's budget. So Healthways has really widened our scope of products and the way that we think about delivering services to people. Of course, we have kind of the traditional physical health applications dealing with obesity, working with partners like Johns Hopkins, and also doing some creative things in the social space. So I'd encourage each of you to go to dailychallenge.com. Dailychallenge.com is from a wholly owned subsidiary that we have in Boston that really is taking the gaming industry that's been so successful and asking the question about how do we apply that to healthcare? How can we get people using those same game mechanics as they think about their healthcare? So we're appreciative of all you're doing on a daily basis. We hope this was informational and helpful to you as you think about kind of your own well-being, and then also thinking about the teams you lead, the people you lead, the counties, the cities you lead, and how we can ultimately improve well-being for Tennesseans. Thank you.
Can you hear me? Yes, okay. Well, I'm going to take a slightly different tact here, and thank you all for being very patient in my efforts to make sure community health centers are well funded. Very important to me. And I hope you had a chance to review some of the literature I sent out beforehand, because I don't want to really repeat that, but it did show you, kind of talk about community health centers as a movement, serving 22 million people for $2.2 billion across the United States. In a way, we're a movement, but we each control our own destiny. We each have our own boards. We're each private nonprofit. And I thought it'd be interesting, what could I say to you about wellness that might be a little bit different? And what I decided was to go back to our roots, and community health centers are going to be celebrating their 50th year next year. And we were part of the war on poverty. And so we're going to talk about poverty and wellness, because I think each of you can have a very important impact in your community in understanding the impact of poverty. So we're going to take one part of the environment kind of and talk about that particular impact, because community health centers were started as the war on poverty. So we were seen as part of the solution to this issue of poverty. And I think we all recognize poverty has not gone away, right? But as community health centers, we have always addressed the needs of the poorest, the homeless, the migrant workers, a lot of our immigrant and refugee populations. These are the folks where we have seen not only the need for health care, but the need for all the other kinds of services that we bring with us. And I'll talk about a few of those models as we go on. But to really, bring this context back home, right now in the state of Tennessee, and I'm sure you each know your own statistics in your community, the population that is the poorest among us are children. A full third of our children live in poverty. And actually, I think it's more like 25%. And another 25% of our children live in 2 times poverty, which is certainly low income and not very much money in that household. So we've got 50% of our children that we can classify as poor. Among our African American population communities, a full 40% of our children live below poverty. among our Hispanic community, which we can get separate information for, we can't for exactly the rest of all our immigrant populations, it's 40% as well. So a very large chunk of children who do not have choice, who do not have those kind of wellness choices, are living in environments that in many cases determines their health outcomes. And that's the most important thing to remember about poverty and wellness. It is obviously very difficult to be well when you're a child living in poverty. Your home is not secure. Your food is oftentimes insecure. Those with whom you live in your community, oftentimes these are the most violent-prone neighborhoods in our communities. Your schools may be among the lowest performing schools. And when you do begin to have choices, what do those choices look like? You may be in a food desert, or you may be in a fast food haven, but neither one of them works for you. You're probably where there are lots of pawn shops and liquor stores and tobacco stores. That is kind of what characterizes the choices that many of our poor children face. And so it's not unusual that we should see among them, the highest rates of all kinds of health issues, whether it's mental health needs, whether it's obesity, whether it's the eventual development of diabetes and hypertension. You name the health conditions, certainly premature birth, infant mortality. We name the health condition, it's going to be significantly affected by poverty. In fact, one of the measures that introduced the greatest improvement in children's health in this country were actually lunch programs in schools. Food. How do you get children more food? When we figured out post-war, I think it was about World War II, but I think there were certain programs even that Eleanor Roosevelt probably did to try to get food to our kids. Food in the schools actually greatly increased the health of children, greatly increased their ability to learn, greatly increased their ability to achieve. So when you look at how are we going to improve the health of our children, the real question is, how are we going to have an impact on the conditions of poverty? And to ask those questions, those very hard questions. If you can raise the minimum wage income, you're going to have a really significant impact on poverty that's going to affect the health and well-being of that child. If you can introduce more food security, I assure you cutting food stamps is not the way to produce healthier children or to improve the health of our communities. So if you can have an impact on food access, if you can have an impact in your community on affordable housing, on the patterns of violence, on the improvement of education. So although I'm here as an advocate for community health centers, if you really want to affect the well-being and the choices, enable people to have healthy choices, then you will focus in on what are we doing about poverty. Now, the only things that we do don't have to be about poverty, but I'm happy to say that we have a mayor who did pull together a very large group of citizens in Nashville to look at the conditions of poverty and set some goals about reducing poverty, and particularly reducing poverty among children. And when you reduce poverty for their parents, you do reduce it for children. There are obviously many other kinds of measures that we can do that are not just cutting the rates of poverty, but are doing the kinds of things that were talked about. Greenways in your communities, walking paths, more food access, improve your schools where they are. All of these will have an impact on well-being. And as community health centers, what we're seeing is we balance that visit with your medical provider because that's still an essential component. We have to be doing the preventive health care. we have to be doing the screening, we have to be doing the treatment. People need that direct. But what they also need are those friendship groups, those groups of people who are part of their circles doing the same things. And so that's where groups of diabetics can begin to talk in a community, or groups of pregnant women in a community can begin to talk about how are we going to give up smoking, or how are we going to get off drugs. I mean, those of you in East Tennessee know the problems that you're facing in terms of the children born drug addicted. I mean, it's just incredible. It's an epidemic in East Tennessee, and will eventually work its way across the whole state of Tennessee. What are we doing to prevent those kinds of things from happening? So again, I think what we have is a lot of community health centers are real well known for community health workers. And those community health workers are people who get out and work in the community, do home visits, talk with people about how to improve their health, but also bring them in contact with other people working to improve their health. Create those friendship groups where none existed to actually drive people in a more healthy direction. We find we have enormous success with very poor people who have been able to improve their diabetic indicators, who have been able to lose weight, who have been able to create safe sleep places at home for their children. There is so much we can do in the community. I oftentimes point out to my doctors, you know, if you want to prevent an elderly person's falls, it's not by giving them more medication or bringing them in for a visit, it's by going into their home and picking up all the throw rugs, right? So we need to look at community-based solutions for health and well-being. And in many cases, what we're pioneering is this effort, particularly in our poor communities, because that's where we think we need to put so much more effort on improving people's ability to make choices and the choices available to them. So hopefully we can get them to this stage where they can actually make choices to do something healthy versus unhealthy, rather than living in circumstances that for them are just basically unhealthy. So we're still fighting that war on poverty. We'll celebrate 50 years next year. Some of you remember 50 years ago when we didn't have Medicaid, we didn't have Medicare, we didn't have community health centers, we didn't have Head Start. Pre-K education, how important that is in improving the well-being of children. So we're going to celebrate it next year, and we're hopefully going to reinvigorate those movements in our communities to look at the whole person. And what are we going to do for the poorest citizens to help them be healthy? So.
We've tried to have more time for questions, and so happy to take questions of either of our panelists at this point.
I'd just like to know where we could get your PowerPoint, or you also mentioned you had, you could go up to Gallup's site. I don't know if you can provide that information today, or if you have a handout, but.
Yeah, I'd love to.
Great.
Is there kind of a centralized way that you guys communicate information out? Okay, great. I'll get all those resources to you. And I'll make sure that that's also in a PDF form, and then also the website.
Good, I was gonna ask if everybody had crazy.
I have the exact same presentation in PowerPoint, if that's
Okay,
helpful as well.
Okay, terrific.
So, absolutely.
Other questions? Rick, how does this relate to what you're doing statewide?
In a big way, We're all focused on the same thing, that try to change behaviors that get us to better health outcomes, and particularly that help to reduce the rates of chronic disease in Tennessee that are so onerous and costing us so much.
Tell us a little bit more about your organizations quickly. Not everybody knows what Healthways
Sure.
does more specifically.
Sure. So Healthways is about 30 years old. We started actually by managing hospitals, and then really moved into the disease management world, and spent a lot of time there. And then as that really we recognized we had to take a total population health approach, that it wasn't just enough. We were leaving a lot of value on the table by just dealing with kind of the 5 main chronic conditions. So moved into a total population approach probably about 10 years ago, and then ultimately took a step back and say, it's not just good enough to look at the total population. You've really got to look at keeping the healthy people healthy, mitigating lifestyle risks, and ultimately working to control chronic conditions within a population. Healthways has historically worked with kind of large health plans, probably in the disease management space, and really we've grown the most in our employer space. So the state of Tennessee is one of our strong partners there as an employer. And now we're kind of coming full circle as healthcare reform has changed. Who's at risk for a population are now again working with hospitals and working with health systems as physicians take on a greater role in that risk.
Mary, United, you all have a clinic here.
Right, United Neighborhood has a network of 11 clinics here in Nashville, Middle Tennessee. But across the state, I think we have probably 17 different organizations and probably about 50 community health center sites, serving a lot of our rural areas because we extend across the state. We're fairly unique in that each organization is, of course, its own entity. Our boards of directors are by mandate because of our federal funding, 51% consumers. Grows out of the old OEO concept of community ownership. And so our patients hire me, and that creates a very kind of different community ownership dynamic. But on the whole, community health centers are really going to be focused on the conditions of their community, trying to tailor their response and tailor their services to what are the current conditions facing their community. So a lot of them, of course, is the epidemic of diabetes across our country, but also in Tennessee. So we'll focus on chronic conditions, but we'll also focus on a lot of preventive health care, so that we believe, for instance, identifying things like anxiety and depression before they lead to major catastrophic outcomes in someone's life, and helping them with them are important. So we're going to be trying to identify, we identify, for instance, pre-diabetes, hopefully before they get to Healthways. Because we know if we do the right things with people who are pre-diabetic, we can actually prevent them from becoming type 2 diabetes cases. So we're trying to work at the preventive end as well as at the end where we already have the epidemic there.
Other question? Okay, I think it's been a long day, and I can see the group sort of winding down.
The lunch always do it.
What we may do is give you an opportunity to quit a little bit early. There's one thing I want to say which may embarrass you, but I'm going to say it anyhow. When we were talking, when the Nashville group was coming together talking about who to have for the various panels, and Nashville and Chattanooga are working on that now, Mary came to mind immediately, and then Michael Burcham and some others said you got to have Melinda Raymond from Healthways, and young professional, best around. Healthways is a going company, et cetera. And so we went ahead and signed her up, and then found out there's another link here, this being Nashville. And so the link is?
I'm Dr. Randy Lowry's daughter.
which is so we waited till the very end to say that, but it's we're so Nashville if there's a link. So thank you for doing this, yes.
Since you brought it up, Melinda and I were talking about an exciting project she has in East Nashville. If you could take 2 minutes on it, I think it would bring all of it together.
Okay.
Sure. So my husband and I actually are working with a team of 6 other people, which are kind of in different stages of life. One is a chief nursing officer at Vanderbilt and her husband, and really kind of taking what we know at Healthways and looking to kind of partner with other kind of community programs to start a nonprofit health clinic in East Nashville. And so we're kind of on that journey of really leveraging Lipscomb resources and other nursing schools and pharmacy schools. We have a huge array of students here in Middle Tennessee that need places to get their clinical hours. And so trying to leverage the work that other great universities are doing and build that in. So we're on an exciting journey as we learn more about our community and we look at kind of improving and taking what we know from a professional perspective and kind of bringing that home in our neighborhood.
Okay, are buses out there?
Well, why don't we, maybe by 2 they will be.
By
So,
2?
yeah,
All
so
right,
we
here-
have about 10 minutes to.
Here's a
He's
suggestion.
out there,
We-
by the way.
Oh, is he? Okay, well then.
Yeah, he parked up there,
Okay.
because I had to get my phone, that's how I.
He's there.
Okay, we're gonna end a little bit early. A suggestion is that if the groups on the bus or when you get back to the hotel, if you wanna take 2 minutes and talk about your projects, and before you separate, just in terms of knowing how you're gonna finalize what y'all are doing, that might be helpful, or you may wanna do it by email. We will be back to, yeah.
So we're definitely going to Knoxville in January?
No, not yet.
You'll know by the end of the week.
Keep on your calendar, January 12th and 13th. It'll be in East Tennessee, and we should know within about 2 or 3 days whether it'll be Knoxville or Chattanooga.
I want to thank Raj in advance for flying all the guys from Memphis to Knoxville.
That's what I'm here for.
And just in conclusion, I'd like to